Kiwi health workers have the capacity to carry out up to 3,500 tests a day, but only 1,700 are being performed.
We simply aren't testing enough yet.
The Prime Minister says the eligibility threshold has been lowered, allowing more people to be checked. There will no longer be a requirement for people to have travelled overseas or have been in contact with a case. GPs already have discretion, but are not always using it. New Zealand has 647 confirmed or probable cases of coronavirus. 1 to 2% are being treated as a result of community transmission. But the actual number is unclear, which is why more testing is needed.
Our testing relative to others is still significant and high, but I have very high expectations of what we will be able to achieve here in New Zealand. The earlier that we get an absolute insight into what's happening in our different communities and regions, the more that will help us make decisions as we exit level 4.
The opposition is calling for New Zealand to follow Australia's lead to quarantine all overseas arrivals for 2 weeks.
Surely we should sort of do the stuff that others are doing that we know would work. And to me that is proper quarantining by the government, testing each of those people coming in.
Prime Minister Ardern says she's satisfied with existing restrictions requiring anyone who's symptomatic and those without isolation plans to quarantine in a hotel for 2 weeks.